All right, here we go with another rip-roaring episode talking about the Green New Deal and what they're trying to do. Now, our topic for this video, healthcare. Wait for doctor. Can't get over-the-counter vitamins. Doctors have to follow protocol. Go.
Boy, it just put me on the spot. Anyway, I don't know. I'm pretty sure everybody who's had to go to the doctor within the last 12 years, no, 10 years,
10 years,
have noticed a big change in your health care and who you can see and what can be done as far as tests and stuff.
They have to, as it says, have to follow protocol. They have to do what they're told to do. And they are drug pushers.
Yeah.
They push these chemical drugs on you that make you sick so that you'll keep coming back and take more drugs. I had what I thought was a heart problem, pain in my chest, and I went to the doctor. They hook me up on this electrodes and all this stuff. Oh, your heart's fine. I still had the pains, and I kept going, and they did several things. The EKG, I got to run on the treadmill and do all this fun stuff. I had to pay to run on a treadmill. Isn't that something? And they said everything is fine. And eventually they ended up taking out my gallbladder. But the solution, I figured this out myself, is that I have low magnesium because I had all the symptoms of low magnesium. And so I started taking magnesium and took care of the problem, no problem. But they're not going to tell me that because magnesium is a mineral or a vitamin. They don't want you taking any natural stuff. They don't get any money from me going to Walmart and buying a big bottle of magnesium and taking it. And it doesn't have 80,000 side effects like all these things that you get. You see the commercials. They come out with some new drug, the Zolexol Pizobanol, and then they have all these side effects. May cause heart attack, diarrhea, vomiting, nausea, death. So take that pill and maybe you'll feel better. You know, they have all these side effects, and on top of that, they intentionally overdose everybody on this stuff to, even if it works for you, you're probably going to get the side effects because you're taking too much and you can't get a dosage that's low enough to get rid of the side effects. And that's all the drug companies following the protocol getting billions of dollars off of this. I mean, these drugs are expensive. Even if you've got good health insurance, you'll pay $5, $10, $15 for a bottle, and then they'll bill the insurance and they'll pay $100, $200 for it. But I can get a bottle of magnesium and that'll be $5. See, that's the good solution. It's something natural. God made your body to need vitamins and minerals and nutrients. And if I find out what I'm deficient in, and I can take the vitamin, mineral, and nutrient, solve the problem. You can't even get a test. Lana's tried it before. Try to get a test to find out if she has what she's deficient on vitamins and minerals. That way you take that, solve the problem. Oh no, they won't let you do that. You can't find a doctor that will let you even take the test. Or there are a couple labs that will do some kind of test like that.
But it costs $500 for the test.
Because it's not covered by insurance. And even if you try to pay the money, they won't deal with you because you have to send it to a lab. You have to go through a doctor. And the doctor won't do it. The doctor said, well, let me do an examination. Oh, no, you don't need that. You need to take the Zolpidem, something. Yeah, take that stuff. You know, they put a lot of X's and Z's in these things. But, yeah, you got to take that stuff. God forbid you should take a vitamin or mineral. Oh, yeah, that's bad for you.
Yeah, I had part of my thyroid taken out. And basically, there's a Lavoxide, something, I can't pronounce it correctly.
You can't pronounce any of these drugs.
Yeah, you can't pronounce them. They can't make it easy.
Sounds a lot like Leviathan,
yeah,
who is Satan himself in Job chapter 41.
Yeah, exactly.
That's another story.
But they told me, my doctor told me, this has been over a year ago, 2?
Oh, it's been 3 years.
3 years since I had it done?
Yeah,
Oh,
3 years.
okay. Anyway, so the first time I took the pill, now I have no gallbladder, and doctors will say, and I can tell you right now, doctors say, you don't know what you're talking about. You shouldn't be giving advice on medicine or vitamins or something. If I'm taking it and it works for me, I'm telling you what is good for me. Now, you are responsible for your own self. This is what we have discovered by taking medicine and what we deal with doctors. So I'm putting that disclaimer out there. All right, you're responsible for yourself. So just take it, put your big girl panties on or put your big husky underwear on and deal with it, okay? Anyway, so they prescribed me this thyroid pill, and supposedly just about every woman in the world is taking it. And so I took it once, and I had this. It messed with my eyes, and so I immediately didn't take any more. I mean, I just took one pill, and that was it. And so I called the doctor, and I took it on a Saturday, and I called the doctor on a Monday. And of course, you got to leave a voice message with the nurse, and then the nurse talks to the doctor, and the nurse comes back and tells you what the doctor says. So I get a phone call from the nurse, and the nurse said, I said, I had, problems. I had a allergic reaction to it. And I could tell she was dreading telling me what he told her to say. And she said, he said, you need to stop reading the internet, and it's all psychological, and keep taking the medicine. And I was like, are you kidding me? Now, I didn't get mad at her, because I was like, she's just relaying the message. And I said, are you kidding me? And she goes, that's what he said. And I said, fine. So I didn't take it anymore. And I have not gone back to him. But I thought, this man is telling me that I don't know my own body. And I'm like, you gotta be freaking kidding me. So I started looking, and we both researched online, and I thought, I'm going to take a multivitamin. And then I went to a health food store, and I thought, well, it's a vitamin health food kind of thing. And I thought, I'm just going to see what they say. And I brought my paperwork in to show that I had thyroid surgery, and this is the medicine that they prescribed me, but I had an allergic reaction to it. And the lady behind the counter was very thorough. It wasn't like some vitamin shops where they just, they just say, you buy whatever you want and we just check you out. She actually had thyroid problem herself. And she said, here is what I take. Because I told her, I said, my hair stopped growing, my hair's falling out and all this. And she said, this is what I take. Well, went home, and I thought, heck, we'll just see what this is. And she said it's natural. And within a week, I noticed my hair had started growing. And I was like, oh, this is great. And so here, doing my own research, I found something that wasn't bad for me, made in China, that helps me with the part of the thyroid I have left. It helps with my hair growing and my memory and the whole 9 yards. And so I'm like, you got to be kidding me. But these doctors also, if you have noticed, got a friend. She works down here. I should say I befriended her. And she works down here in one of the Walmart. Really nice woman. And she's been sick, just sickly. She's this little like 2-pound little tiny little thing. And of course, me being a southerner, she's not from the South, but she's moved down here. I said, girl, you need to eat. I said, you ain't got no meat on you. And but the doctor keeps pushing her off. She gets an appointment with a doctor, and then he sets her up with tests, but she's got to wait a month to get the test. And this is not just the United States. I don't know if anybody's noticed that in order to get tests, it's being put off more and more. Some people are not able to get their tests like ASAP. Like back in the day, you know, your doctor says, all right, go across down to the 3rd floor, and we'll set you up an appointment. We'll get it done. If not, it'll be done the next day. Nope, can't get that done anymore. Now the government is trying to determine whether or not if you should get the test. They're pretty much, the government is weeding people out. I mean, they're pretty much killing people. The new healthcare system. So she for about 3 months now, she could have gone and found out what's wrong with her. But one day I walked in there and I said, where you been? She goes, she said, I've been out sick for 2 weeks. She goes, I was jaundiced. My eyes were so yellow. My husband was like, what's going on with you? And I said, oh my gosh. I said, so did they finally get you in to see the doctor? Or did they give you some kind of antibiotic or something like that? She goes, no. She said, eventually my eyes started clearing up a little bit. And I said, they didn't give you anything? She said, no. She said, but, and I looked at her and her eyes were still a little, like a faint hint of yellow. And I'm thinking, oh my gosh. Back in the day, she would have been slapped up in the hospital or given an IV or something. But this is what we're going through. I mean, you're having to wait forever to either see your doctor or have tests done, or it's like they're pushing things off in order for you to die. They're doing socialism. They're weeding out the weak and thinking what's going to be left is the strong, but really they're pretty much killing anybody over a certain age. And even the young people today, they have brittle bones. Pretty soon the government's not going to have anybody to rule over because they pretty much messed everybody up health-wise. Got anything else?
Doctors are legal drug pushers.
Yeah.
You go to a doctor, they're not interested in what is the best course of action to cure you. The problem is that doctors have to pay an incredible amount of money for malpractice insurance due to all these lawsuits that have taken place over the years. And so then they're controlled in order for them to get lower premiums on their malpractice insurance. They have to agree to certain things that they will do or say. Meanwhile, the big money is in the drugs that they prescribe. So their goal when you come in is to make sure they follow the protocol of the malpractice insurance. We've noticed that with the doctor that Lana mentioned and she went to at first. And, a year or two later when she went back to that same general doctor, the way he talked to her was a lot different then. See, the malpractice insurance people are cracking down. It's like if you don't make sure you avoid saying certain things or, doing certain things, then you're going to have an increase in premiums because the chances are you're going to be sued. So they have to follow this protocol in order to survive, in order to be able to afford the malpractice insurance. And then they have to prescribe drugs and get through as many patients as they can so that they can have the money to pay for the insurance and, of course, their lifestyle and everything else. So what it means then is that when doctors see you, they're not interested in curing you. I used to go to this old-timey doctor, and every time I left, if I had a problem, he'd give me a typewritten just a little like an index card, and it would say, here's what you do. You know, you take some Epsom salt, you put it in the water, you do this, you soak your feet, or, you know, whatever it was. It would be some home remedy that he would give me. They're not doing that anymore, because that home remedy, he doesn't get any money off of that. But if I buy some drugs, then the insurance is paying a couple $100, I'm paying $10 or whatever it is, and so then they can get money. So it's not about what will cure your problem. It's about finding an expensive drug that will alleviate some of your symptoms and then create more symptoms, because then that way you can come back. And that's what it's all about.
Oh,
money.
I forgot. Yeah.
You forgot.
It's money. If you've got Blue Cross, I don't know if anybody has noticed this, but there's a thing that they have put out. It's called Teledoc, where you can talk to a doctor, a supposed doctor, over the phone. Like if you got the sniffles or you got allergies or, you know, something. And they can call in a prescription for you. So that way you don't have to go into the doctor and you don't have to wait on a doctor's appointment. So we tried this out one time. I needed some antibiotics, let's see, how can I say this? Anyway, I needed some antibiotics. We'll just say that. And I knew I needed antibiotics. And I called, and we tried it out the first time. This man came on the phone. He sounded like he was from India. And I thought, good gosh. I thought, now everybody in India knows my health issue. And so he said, I'm going to prescribe you such and such. And I said, look, I'd much rather have amoxicillin. That's the only thing that works on me. Everything else I'm allergic to. Amoxicillin. And he goes, okay, I'll give you amoxicillin. And I didn't have to argue with him. I was like, all right. He called it in, and within 10 minutes, the pharmacy sent me a little text saying my prescription was ready. I was like, wow. It's like, man, this is good. All right, 6 months, 8 months later, I have an issue. I ran out of, because they didn't give you but just a few amoxicillins. They didn't give me that many. So I'm sitting here and I'm like, I call, and this time this woman sounded like she was up north, like New Jersey or something. And I told her, I said, it's the same issue, but I need, I get this usually 2 times a year, and I need amoxicillin. Oh no, we need to find out, have you, what about this? She's trying to ask me all these symptoms. Well, and I'm like, 6 or 8 months ago, I called and the guy gave me amoxicillin. That's the only thing that works for me. Oh no, you need to try this. And it was some drug I had never even heard of. You need to try this, or we need to determine if you need this. And I'm like, no, I want amoxicillin. And man, this woman, she kept, and all of a sudden it sounded like she was reading from a script. I mean, it was just like it was flowing too easy coming out of her mouth, but she wouldn't shut up. And I said, ma'am, and she wouldn't shut up. And I said, will you shut the beep up and let me speak? And she shut up. And I said, I am allergic to everything but amoxicillin. That's all I need is amoxicillin. Amoxicillin is not a narcotic, not unless somebody has done something to it, but it's not a narcotic. I just need it to clear up. And I said, I've had it before. Oh, well, if you're allergic to stuff, then we just can't, you need to go see a doctor. And I'm like, what the hell are you talking about, woman? I'm like, I called this Teledoc thing before and you gave me what I needed. Now, Blue Cross is telling me that I have to go into the doctor. First, you don't want me to go into the doctor. You're trying to say, oh, you don't need to go to the doctor. You can just talk to somebody over the phone. And now you're telling me I have to go into the doctor just to get amoxicillin? Are you kidding me? And the woman just kept, and then she started back up and she started talking. Well, you need a really good, we can set up an appointment at Orlando. And I just hung up on her. I said, forget it. This is what we're going to. They're wanting you to call over the phone. And if you get somebody different every single time, and if they don't have in their computer that you have already called, they prescribe something, and if it's the same issue, say allergies. Say like you just have sinusitis, and they called you in this and it worked. Well, the next time the season comes around, you call back and say, hey, I have the same symptoms again. They want to give you a different prescription. They want to give you something you never heard of. And like Eric said, they're pushing certain specific drugs that they can make the most money off of because they get a kickback for pushing these drugs. All right, I'm off my soapbox.